I wanted to talk to you about the influence of medication on hair and how that factors into the hair transplantation procedure, but also for those people who are not really considering a surgical option and really just want to go down the solely medical route. Medication is very important. What medication provides that a hair transplant doesn't is insurance against loss of your existing hair. Over the course of your life, if you're not on anything that stops you from losing your hair, you're just going to keep losing your hair. And there are some instances where we can transplant our way out of hair loss, but if you're going to continue losing your hair, there's only so much hair on the back and sides of your head, and we're not going to be able to return significant thickness up to the top. The donor area at the back and sides of the head is not a pantry that we can just keep raiding whenever we want. It's a finite resource. And so one of the best bang for buck options that you've got as a patient is to be on medication to try and prevent you from losing more of your hair. Medications are broadly speaking divided into blocking agents and stimulatory agents. There are a couple of medications on the market that I can't mention the name of because of the laws in Australia, but they block conversion of testosterone to dihydrotestosterone. So they don't affect your testosterone level per se, but they stop a peripheral conversion of testosterone to dihydrotestosterone, particularly in the scalp where there's a lot of an enzyme there called 5-alpha reductase that does that conversion. And what this particular medication does is inhibit the effects of that enzyme so that you don't get such a buildup of that dihydrotestosterone in the scalp. And the significance of dihydrotestosterone is that it's toxic to follicles. And there are some, particularly men, who are more susceptible to DHT or dihydrotestosterone toxicity than others. And in those men, this medication is particularly beneficial because it blocks that conversion. That's why they're called blocking agents. So what that medication does in particular is stop you from shedding hair. It doesn't promote new hair growth. It doesn't do that at all. It just stops you from shedding hair. So that leads me to my next point, is the other medication that we tend to start people on. Again, I can't mention the name of it in Australia, but this is what we call a stimulatory medication. So it stimulates increased blood flow and nutrient delivery, oxygenation to the follicles in the scalp, and it thereby promotes healthier growth of the hair. This medication works particularly well on hairs that are not less than 50% of their normal caliber. So if a hair has lost greater than 50% of its caliber, then it's probably a little bit too far gone to get back. But if a hair has greater than 50% of its normal caliber, then often this stimulatory agent can really be beneficial in promoting thickness of that hair. In some instances where the hair has only been lost very recently, say in this last 6 to 12 months, we may be able to get that hair growth back again. But let's not forget that thickness of hair is contributed to by two factors. It's the number of hairs there, but it's also the caliber of each hair. And the more caliber and thickness we can get in a hair shaft, the more the illusion of thickness that we will get in someone's hair. The stimulatory medication really contributes to perhaps sprouting a few new hairs, but also increasing the caliber and thickness of the hairs that are already there. Now, there are some parts of the scalp that tend to respond better and others worse to medication. The hairline and nude skin don't tend to respond as well to medication. If you're trying to re-sprout hair in nude skin, that ship has sailed, unfortunately. We're not going to get that hair back. And that's where we're heading into transplant territory. But particularly the crown, and to some extent also the mid-scalp. So the crown is this area here, the mid-scalp is just behind the hairline and in between the crown and the hairline. Those areas tend to respond a little bit better to medication across a lifespan. Also, we need to talk about age groups and medication. So younger men tend to respond more to that blocking agent than, say, an 80-year-old man. And people that have a well-balanced diet, who are non-vegetarian, whose iron levels are adequate, whose vitamin D levels are adequate. Vitamin D and iron are very important for hair growth. As long as those factors are covered off, then medication tends to work very well in those groups as well. One last adjunct that I wanted to make to medication is the use of platelet-rich plasma. We have one of the best systems on the market here at Hair Transplants Melbourne. We use the Elicuro system. It generates really maximum high numbers of platelets, and the more platelets we can get in a PRP sample, the more growth factors those platelets then dump when we inject them into the scalp. And it's those growth factors that promote stem cell activation and then follicle growth. But PRP is not necessarily designed to be a standalone treatment for hair regrowth and hair thickening. So it really works well in people who are already on maximum effective doses of medication. Then we add PRP in to be that monthly boot camp, and we will usually prescribe a course of 6 PRPs on the background of medication to really try and enhance and kickstart your hair growth. Once we've reached a point where we've maxed out those treatments, then we can then say, no, look, this area, particularly your hairline or a nude area where we're trying to get hair, then you're heading into hair transplant territory.